learning objectives for Module 7 by Dr. Knox, entitled Variations in Sexual Behavior, Sexual Disorders, and Sex Therapy. Variations in sexual behavior, also known as paraphilias, refer to atypical sexual interests or urges that can be a source of distress or impairment for individuals. These variations encompass a range of behaviors, from those involving unusual objects or situations to those involving non-consensual acts. Understanding these variations requires considering both psychological and social factors, as well as the potential impact on individuals and society. Let us review the definition and types. First, paraphilias. These are persistent and recurrent sexual interests, urges, fantasies, or behaviors of marked intensity involving objects, activities, or situations that are atypical. Next, consensual versus non-consensual. Some variations involve consensual activities, while others can be non-consensual and potentially harmful. Some examples of paraphilias can include interests in objects like fetishism, or situations like voyeurism and exhibitionism, or even activities like sadism and masochism known as S&M. Next are the psychological factors. First, developmental. This is where early childhood experiences, attachment patterns, and learned associations can play a role in the development of paraphilic interests. Next, cognitive distortions and maladaptive thought patterns can contribute to the persistence of these behaviors. Also, regarding neurobiological, this is when brain structures and neurotransmitter systems involved in sexual arousal and behavior may also be implicated. Next, social and cultural influences. First being cultural norms. Always remember, what is considered normal or abnormal varies across cultures and time periods. Next, in social learning, this is where exposure to certain behaviors or attitudes through the media, peers, or family members can influence sexual preferences. Regarding context, the social context in which sexual behavior occurs can significantly impact a person's perception and interpretation. Now, let us review impact and treatment. First, the level of distress and impairment. Paraphilic behaviors can cause significant distress or impairment in an individual's life, impacting relationships, work, and social functioning. And next, treatment options. Treatment approaches may include therapy, such as cognitive behavioral therapy or psychoanalysis, and also medication, depending on the specific paraphilia and the individual's needs. Upon completion of this lecture, the student should be able to identify variations in sexual behavior, recognize characteristics on hypersexuality and asexuality, and explain some therapeutic techniques in sex therapy.
Please be advised, this is an educational, academically sound psychology course by Dr. Knox for adult student learners. Lecture content include discussions and representations of human sexuality, theoretical perspectives on sexuality, sex research, sexual anatomy, sex hormones, sexual arousal, attraction and love theories, gender and sexuality, sexual orientation, variations in sexual behavior, sexual coercion, sex for sale, sexual disorders, and sex therapy, ethics and religion on sexuality, and sex laws. Before beginning the course, please be mindful of your capacity to witness and respond to videos, books, and images of this content material.